Welcome to our video on vascular pathologies of the skin. Let's get started. In this video, we'll be discussing strawberry hemangioma, cherry hemangioma, cavernous hemangioma, pyogenic granuloma, Kaposi sarcoma, bacillary angiomatosis, and some more miscellaneous cutaneous vascular lesions. Let's start with strawberry hemangioma. It's a benign vascular neoplasm of infancy, meaning that it's a benign proliferation of endothelial cells. Now, since it affects infants, it's also known as infantile hemangioma, which is kind of cute. You think of infants and strawberries seem kind of appropriate for infants and cute. Anyways, it's an easily identifiable hemangioma given its peculiar clinical course, in that it usually appears in the first few days or weeks of life, and it presents as a painless, well-demarcated strawberry-colored lesion. Now, the color may range from light red to dark brown, or even violet in some cases, and it most commonly occurs in the head and neck, and it's usually solitary. So there's just one strawberry hemangioma right there, although variations may occur. It undergoes a phase of rapid proliferation, where the endothelial cells proliferate and the lesion enlarges rapidly in size, usually during the first year of life. Now, this is followed by slow, spontaneous regression, and hence the majority of the cases resolve on their own by 7 to 9 years old, and no intervention is needed. Now, because of this characteristic clinical course and typical morphology of the lesion, the diagnosis is made on history and clinical exam in most cases. So this is a clinical diagnosis. And since most cases resolve on their own, the management usually includes reassurance only, because it can be kind of scary with a rapidly growing, persistent growth on your kid's face. It makes sense you'd want to reassure the patient and their parents. However, sometimes we may need to use medical or surgical treatment. Examples of such cases would be patient preference, or really you're thinking cosmetic reasons. Now, a hemangioma on the eyelid, one that's obstructing vision, is another reason. Also, if the hemangioma is disfiguring. And of course, if the strawberry hemangioma doesn't resolve on its own, you'll need to intervene then. For such complicated cases, oral propranolol is the treatment of choice. Now, other options include laser therapy and surgical excision. Here's an image showing an infant with a strawberry hemangioma. Note the well-circumscribed red to violent lesion on the infant's nose. Next on the list is cherry hemangioma. In contrast to strawberry hemangioma, cherry hemangiomas are the vascular tumors of adults. These are the most common benign vascular proliferations in adults, consisting of dilated, interconnecting capillaries. And these mostly appear after age 30, and you'll see multiple bright red macules or papules, so they're pretty small. And they can appear anywhere on the body, but they're most common on the trunk and extremities. Another contrast between cherry hemangiomas and strawberry hemangiomas is that the cherry variation does not spontaneously resolve. So how do you diagnose them? Well, just like strawberry hemangioma, these are diagnosed clinically. And these lesions are generally harmless, and therefore they really only require reassurance. However, removal of these lesions via electrocautery, laser therapy, or surgical excision may be required in some cases. For example, when patients want these to be removed for cosmetic reasons, it's one of the most obvious reasons, or when there's profuse bleeding after a trauma. Here's an image showing a cherry hemangioma on an adult patient's arm. So you can see it's small and well circumscribed. And as we mentioned before, cherry hemangiomas are on the trunk and extremities. So here it is on someone's arm. Now let's discuss cavernous hemangioma. Cavernous hemangioma is more of a vascular malformation than a vascular tumor. And unlike vascular tumors, like those strawberry and cherry kind, that generally appear after birth, cavernous hemangiomas may be present congenitally, meaning they're present at the time they're born. And these consist of dilated, interconnecting vessels forming large cavernous spaces. And that makes sense. If you have a bunch of large, dilated, interconnecting vessels, their combined lumen can be much larger, and you get this large cavernous space. Now, they may be initially small and not apparent, and later they just grow in size due to the filling up of those dilated spaces. They, of course, fill up with blood. And that's not due to endothelial cell proliferation, as we discussed with those other hemangiomas. They're just getting bigger because they're filling up with blood. Now, while these can be found on the skin, the visceral forms are more clinically important, especially those involving the brain, eyes, and liver, and those will be discussed in their respective sections. Here, we'll only mention a few important points. Cavernous hemangioma is the most common benign tumor found in the liver, and it's also the most common intraorbital tumor found in adults. Now, this is a painless, slow-growing mass, and hence, many times, it remains asymptomatic and only appears as an incidental finding on imaging. Now, being composed of large spaces filled with a lot of blood, its rupture may lead to life-threatening hemorrhage. In fact, for that same reason, biopsy is contraindicated if this lesion is suspected in a patient. Additionally, some patients may be symptomatic due to mass effect because these lesions just increase in size as they fill with blood. or they'll be symptomatic because this lesion hemorrhages. The symptoms then are in accordance with that organ involved. For example, when in the brain, the mass effect could result in seizures and focal neurologic deficits. When in the liver, it usually presents as right upper quadrant pain and or fullness. And when it's in the orbit, the extraocular muscles may be dysfunctioning. And in fact, the patient may even have proptosis, pushing the eye forward. Visceral hemangiomas are usually diagnosed on imaging. For example, ultrasound mostly picks up hepatic hemangiomas. Now, contrast-enhanced CT scans and MRIs are other modalities which can be used to further evaluate those hemangiomas you find. And again, do you want to biopsy these? No. That is contraindicated because you can just cause massive hemorrhage, which makes sense. It's just a big cavern full of blood. Now here's a histologic image of cavernous hemangioma of the liver. You can see the large cavernous spaces here. And what's filling those caverns? Blood. Let's quickly do a review question before we move further. Now, a 40-year-old male presents to the office with the complaint of a small red lesion on his leg. It measures 7 millimeters by 3 millimeters, and it's painless. Similar lesions are present on his back and trunk. What could be the diagnosis? Now, this is most likely a cherry angioma. Such acquired small red painless and benign lesions in an adult should raise the suspicion of cherry angiomas. And we say acquired because it occurred while he was an adult. In fact, these are the most common acquired cutaneous lesions of adults. So we're fairly confident this is a cherry angioma. Now let's discuss pyogenic granuloma. A pyogenic granuloma is another benign vascular growth. It develops rapidly as a soft, round lesion, usually at sites of trauma. Another clue that it's a pyogenic granuloma is that it bleeds easily. Contrast that to what its name suggests, it's not infectious. And you would think that because of pyogenic, it's not. It's not infectious. Nor does it have any microscopic granuloma formation. So the granuloma part isn't true either. So this name is completely a misnomer, but pyogenic granuloma. And the diagnosis is usually made clinically, and the treatment options include surgical excision and cryotherapy. Here's a picture of a pyogenic granuloma. Note the small, well-circumscribed, round vascular lesion on this patient's thumb. It's pretty obvious. And when you look at it and hear its name, pyogenic granuloma, you'll think, oh, is that infected? And is that a granuloma? And it's really neither. Next, let's discuss Kaposi sarcoma. Kaposi sarcoma is a malignant vascular tumor caused by herpes virus 8 infection, or HSV8. It presents as violaceous papules, nodules, or even plaques, and it's most common on the lower limbs, face, and neck, but they really can appear anywhere, such as the trunk, even the genitalia, or the GI tract, and other viscera. But the one you're going to see visually in clinic is really the dermatologic findings. Now, it's primarily found in immunocompromised patients, particularly transplant recipients or patients with HIV. In fact, this is the most common malignancy associated with HIV. However, the incidence in HIV patients has now decreased with the advent of highly active antiretroviral therapy, or HAART therapy. Now, it may be diagnosed clinically, or when in doubt, it can benefit from a biopsy. Now, biopsy shows spindle-shaped cells with vascular proliferation and lymphocyte infiltrate. For management, first, the patient is started on HAART therapy if they have HIV. Secondly, the lesion itself can be treated with radiation, laser therapy, or surgical excision, and they may benefit from systemic chemotherapy, for example with doxorubicin. This is a picture of Kaposi sarcoma on the skin of an AIDS patient. Note the red to brown, you could say violaceous, macular, and papular lesions. Here's the microscopic image of Kaposi sarcoma. It shows spindle cells with abundant blood vessels. Scattered among these, we can also see lymphocytes with their dark nuclei. Now let's discuss bacillary angiomatosis. Bacillary angiomatosis is a vascular proliferation caused by Bartonella species, particularly Bartonella henselae, which is transmitted by cat scratch. Now, just like Kaposi sarcoma, it affects immunocompromised patients, particularly those with AIDS or an organ transplant recipient. Now, it appears as a red papule, nodule, or a plaque, and it can be solitary, or there can be multiple found. Additionally, these patients can have constitutional symptoms, such as fever and malaise. And that part is fairly intuitive, because now you're thinking this is a bacteria, Bartonella henselae, and they got scratched from a cat, potentially. At least that's what the textbooks say. And they have fever and malaise. And fever and malaise is really something you'd expect when someone is sick. So it makes sense that they would have these constitutional symptoms. Morphologically, it may mimic Kaposi sarcoma, and the definitive diagnosis is generally made on biopsy. So you want to make sure that this is not a malignancy. And when you do biopsy this, you'll see a vascular proliferation with neutrophilic infiltrate. Now contrast that to Kaposi sarcoma, which shows a lymphocytic infiltrate. So when you think lots of neutrophils in the biopsy, think of Bacillary. Now, demonstration of Bartonella bacilli by Wharton Starry stain, PCR, or immunohistochemistry, IHC, confirms the diagnosis. And being a bacteria, you would treat it with antibiotics, for example, erythromycin and tetracyclines. Now let's do a review question. A 37-year-old male presents to the office with the complaint of fever, nausea, and headache for 2 weeks. This morning, he vomited 3 times and is now confused and drowsy. On examination, meningeal irritation is noted. Labs confirm cryptococcal meningitis and appropriate therapy is started. After stabilization, thorough examination reveals 3 to 4 bright red nodules on the left knee of the patient. Biopsy of one of the lesions shows vascular proliferation with neutrophilic infiltrate. Starry Wharton stain confirms the diagnosis. What is the appropriate treatment for these lesions? So this patient has cryptococcal meningitis, an infection which occurs in severely immunocompromised patients. So this patient likely has AIDS. As we discussed, presence of such bright red nodules in an immunocompromised patient should raise the suspicion of Kaposi sarcoma, as well as bacillary angiomatosis. Now, since biopsy of Kaposi sarcoma shows lymphocytic infiltrate, whereas bacillary angiomatosis shows neutrophilic infiltrate, the diagnosis here is most likely bacillary angiomatosis. Furthermore, Starry Wharton stain, which is used to demonstrate Bartonella bacteria, has confirmed the diagnosis. And if you want help remembering those facts about Bartonella Hensley, you should see our image mnemonic in our microbiology chapter. Anyway, the treatment here should be antibiotics, such as erythromycin. Now let's discuss some miscellaneous conditions. So we'll start with spider angioma, or a spider nevus. This is a type of telangiectasia in which we see a central arteriole from which there are some capillaries that radiate outward. So they get that spider appearance, or telangiectasia. Now this is typically seen in patients with hyperestrogen, or in a hyperestrogenic state, such as cirrhosis or estrogen therapy. This is a picture showing spider angiomas. So you can see that radiating pattern of capillaries. So it makes sense that you'd call it that spider, or telangiectasia. Now, port wine stain is the most common capillary malformation. It's seen as a red discoloration, and it's present at birth, and it's usually associated with the neurocutaneous condition Sturge-Weber syndrome. This is an image showing a port wine stain on a leg of a patient. And you can see that red-colored patch on the skin. And again, when you see that, you start thinking of that neurocutaneous Sturge-Weber syndrome. Lastly, lymphangioma. This is a rare type of congenital vascular malformation composed of lymphatic vessels. This is an image showing a child with cystic hygroma, which is a subtype of lymphangioma. So this pathology that this poor child has is a congenital vascular issue, it's a malformation, and it's composed of lymphatic vessels. Now let's end this section with a question. An 8-month-old infant is brought to the office by her mother with the complaint of an enlarging lesion on the back of his neck. She first noticed it while bathing the child 2 months ago, when it was only like a red pimple. Since then, it has been steadily and rapidly increasing in size and has also darkened in color. The mother is not sure if it was present at birth or not. The lesion does not appear to bother the child at all, nor does it bleed. The rest of the examination is normal. What is the most likely diagnosis? A. Strawberry hemangioma, B. Cherry hemangioma, C. Cavernous hemangioma, or D. Pyogenic granuloma. Alright, so this is the case of an 8-month-old infant with a rapidly enlarging lesion on the back of his neck. Although the mother is not sure if it was present at birth or not, the red color of this lesion and its presence during infancy and the subsequent steady and rapid increase in size and its harmless nature, there's no symptoms, shown by the fact that it doesn't appear to bother the child at all point toward strawberry hemangioma as the correct answer here, choice A. This is the most common tumor of infancy and undergoes a rapid proliferation phase, followed by slow, spontaneous resolution. Now let's discuss why the other answer choices are wrong. B is wrong because cherry hemangioma is a vascular tumor of adults, and you usually see multiple at a time. Choice C is wrong because it's much less common than strawberry hemangioma in an infant. Now D is wrong because pyogenic granuloma usually develops over a few days at a site of trauma and bleeds easily. And that concludes this section.